What is my dental practice worth? So I know a lot of you guys right now are thinking about that or kicking that back and forth, and at least in our markets, we're seeing a lot of disruption. So I wanted to make a quick video kind of about the two different ways that we've seen the most common ways to evaluate your practice, and a little bit of the nuts and bolts to them. So, and you can find a previous video, but really the two main ways that we've seen these dental office valuations happen is it's either a percentage of collections or it's an EBITDA valuation. So really, and it will depend on the setup of your practice and what you guys are doing, of maybe what looks better for your guys' numbers. But really, the market used to be pretty much only percentage of collections. And then recently, in the last 10 to 20 years, with the increase of private equity money and institutional money, it's really started to move very heavily towards more EBITDA valuations. I think the EBITDA valuation gives a little bit better number of what the true kind of profitability at the office is based on that percentage of collections number. So really, and there'll be more videos to come kind of comparing and contrasting the differences, but historically, from a percentage of collection standpoint, 80% of collections is a rough estimate of a way to do a percentage of collections valuation. Now that's gonna again fluctuate based on your patient base, the type of dentistry you're providing, all of those good things. But again, just from a simplistic standpoint, 80% of collections is pretty standard. In terms of EBITDA valuations, there's more variables involved in this valuation, and there's different ways to do the formula, so that there can be a big difference of what that number is that comes out. So, and again, your EBITDA is your earnings before interest, taxes, debt, and amortization. So basically kind of a gross profit perspective that's able to kind of get you, again, just that rough kind of overall gross profit number. And then what will happen is you will get you will do a multiple of that EBITDA. So we've seen things as low as 2 times EBITDA up to 10 times EBITDA, and really just depends on the setup of your group or your practice. Specialists get a higher EBITDA multiple than general dentists. Group practices get a higher multiple valuation than solo practitioners. And the more profitability that you have in your practice, again, the higher your multiple is going to be as well. So there's a lot of factors that go into that EBITDA valuation. We're going to make a video overall just going over specifically what can fall into that EBITDA category and what can't, because again, you can have things that you add on to EBITDA, you can have things that you add back out of EBITDA. There's a lot of ways you can kind of play with that formula. So we'll give you guys more content on that, but overall, just from your guys' understanding of what is my practice worth, I think the first thing to look at is, where do your numbers look better? Do you look better trying to get a percentage of collection deal, or do you look better trying to find out what your true EBITDA number is, and then coming up with a multiple that you guys think you're justified for receiving based on what you guys are doing at your specific office, or the unique value prop that you guys have in your specific location. So comment down below with more, but again, there's a lot more content to come.